Thank you, Madam Chair. Dr. DK and Dr. Gebbia, I want to say, first of all, thank you for your kind words and your testimony about the subcommittee's work to provide a 5% crisis care set aside in the mental health block grant. Like you, I was very pleased that we were able to pass this provision out of my Crisis Improvement and Suicide Prevention Act, that we could turn that into law. Crisis funding helps mental health providers in all over. In a district like mine, we have Rosecrance in Rockford, Illinois, Robert Young Center for Community Mental Health in the Quad Cities, and Unity Place in Peoria, Illinois. And they fund crisis call centers, mobile units, so they can travel to patients in crisis, and so much more. You get the picture. I also want to say thank you to the American Psychiatric Association, the American Foundation for Suicide Prevention, and so many others who supported this effort. My question to both of you is, if you could be specific in how this dedicated crisis care funding is helping states and providers, so we have a good picture on that. Dr. DK, why don't you start, please?
Well, thank you very much for that. I would say that the funds provided by this subcommittee, by the way, thank you all for doing that. It's been very helpful, sorely needed, but different states are using them differently, depending on their needs. I'll just give you a couple of examples. Some states are supplementing their existing crisis systems. For example, in Connecticut, the initial goal was to expand our mobile crisis to 24/7 across all the different areas of Connecticut. Before then, even though we had mobile crises across all of Connecticut, not all of them were 24/7. And that is really important because crisis does not time itself when it happens. So that's one way that that is happening. Some other states are actually starting from the scratch, quite frankly, to building up their whole emergency crisis system from the start. Some states are starting, laying emphasis on the 988 implementation program. Connecticut is one of them. Mobile crisis teams, as I mentioned, crisis stabilization units. Now, we don't have that in Connecticut yet, but that is really an important area for us. I happen to be the guy in the middle when emergency rooms are calling because they have too many people in emergency rooms with mental health disorders, and I'm the chief medical officer for the Department of Mental Health, and they're saying, where do we move these individuals to? So the continuum of crisis care centers, the importance of them cannot be overemphasized. Even clinical respite crisis beds in that continuum would be very helpful. Some states are using it as a one-time fund for crisis receiving and stabilization infrastructure for children and families. Others are using the fund for stakeholder engagement and additional planning. Some are using it to increase operations with peer support and peer respite programs to add to mobile crisis, because it's really important for individuals who have lived the experience to participate in this process. So there's a long, important ways that states are using it differently.
Dr. Gebbia, can you add anything to that, please?
Yes, I think that's exactly right. Each state is using these funds slightly differently, depending on what infrastructure they already have and what their needs are. And I think that's the right way to approach it. I would say this, though. I think it's a start. I do think that that level of funding is not going to go all that far when you look at such massive change in how we want to respond to crises. And I would certainly suggest that that be increased if possible, that percent, because in fact, most states are not going to be able to implement enough change as a result of that, although it's a terrific start and we support it, and thank you for that. I would just add one other thing. I do think that as we look at changing the system, we're going to need to invest a lot more over time. As 988 gets out there and demand goes up, states are going to find they're overwhelmed. And I do think that we have to continue to look at all of these aspects, from mobile crisis to training, to the infrastructures we're going to need, to how it works. How does 988 work with 911? What's the integration? All of these things we've been talking about. But I do think that block grant is a step in the right direction. We're grateful for it. If that could be increased, I think the states will be able to use it wisely.
I've got a little less than 30 seconds, so let's play off of that very quickly. I also support increasing the crisis care set aside to 10%. If you could outline why that would be needed to the point that you just made, Dr. Gebbia, and how this increase would help our communities.
Well, I think again, it would just let them move faster in terms and more deeply in terms of how they set up crisis response and all the kinds of alternatives we've been talking about throughout this hearing. I think it would provide a higher level of support that they need.
All right, very good. I'm
Appreciate
out of
that.
time. With that, Chair Delora, I yield. Thank you so much.
Thank you.